Hey, hello, this is Dr. Lewerenz, the Longevity Health Institute in Rochester, Michigan. Also, we have a location in Madison Heights, Michigan. I post a lot of these videos that are informative and hopefully helping your quality of life and quantity of life, and also bringing a lot of holistic, natural, integrative, and alternative kind of advanced approaches to healing you. And hopefully this is educational. My patients tell me when they watch these, one thing I've been kind of missing on and not kind of sharing a lot with them is nutrient things and maybe some supplemental things and advice that are key things to potentially look at for helping your body function better, more optimally, but also to get the full effect of some beneficial things that often are overlooked. So, I could go over everything from B12 to vitamin D to carnitine to curcumin and turmeric and all these, and maybe I'll touch upon a lot of these. But one I think that is underappreciated, undervalued, undertested, and I think it means a lot in your overall health, and that is magnesium. Magnesium is a water-soluble vitamin. It's something that you get in your fruits and vegetables every day. As we age, we tend to absorb less magnesium, and our needs for magnesium go up. And there's many features that go and can be affected by magnesium, even things from mood to energy to anxiety to decreased sleep to bowel function to muscle fatigue and muscle twitching to cramping to constipation to, I could go on and on and on. But let me talk about something that's really common with magnesium deficiency or insufficiency, okay? By the way, anytime you have your magnesium level checked, it should be checked by a red blood cell or a micronutrient, a cellular test. So you're checking what is in the cell, not just what's in the serum or what somebody took at that moment or an hour or two or earlier in that day, okay? Very important. Getting optimal levels of magnesium can't be toxic. Water soluble, which you don't use, you eradicate through urine or your stool. But getting optimal levels is super key. Now there's many details I could go over this with as far as your ratio of magnesium to calcium to vitamin D to vitamin K, etc. But one of the key things is this. We see deficiency, and studies show this, in 70% of adult individuals. 70%. Now, could you just eat more things that have and require magnesium? Yes, you probably could, and you could focus on that. But I will tell you that is what is profound and something that I see here that's an easy fix when I have a patient that's constipated or has slow bowels. And this could be because of hormonal things like thyroid deficiency. Maybe they're taking a medication that side effect is slowing their bowels. By the way, commonly narcotics or pain medications will slow their bowels. Anti-anxiety medicines will slow their bowels. Sleep medications, all these neurologic affecting medications slow your bowels and your GI system. Upping your magnesium and getting a more therapeutic high level of magnesium, and particularly the one I like, which I'll cover in a minute here, is a glycinate form, but will help relax your bowel and you'll get more regular bowels and stool formation. But constipation can be easily resolved or at least helped along by upping your magnesium level. Okay, and again, very hard to get toxic. It's water soluble, which you don't use, you put in the toilet. Hard to get excessive. The other thing is this: the demands of magnesium are much higher in somebody that is very energetic and physical and using their muscle and working out a lot and sweating a lot. Okay, you lose a lot that way. Magnesium does and is very important in the whole lactic acid, which creates that muscle soreness and muscle fatigue. So people that work out and go to the gym every day and exercise a lot need and really require a higher magnesium demand. And when you take magnesium, you'll find that you often have less muscle cramps, muscle soreness, better muscle integrity, recover quicker than that, okay? So it's a key thing for muscle recovery, for bowel function. It's relaxing to the neurologic system in the body, so you can take it at night. The way I like and direct patients to take, I prefer typically, and there's many other forms that are also effective, but I prefer magnesium glycinate, also a chelated form. I tend to use a product from Zymogen. You can find this on our website through our storehouse, Longevity Health Institute Inc. .com. Just go to the storehouse. and actually we drop mail this stuff to our patients all the time. But magnesium glycinate is the best form, I think, for muscle and bowel function. Relaxes the bowels, relaxes the muscles, gets rid of lactic acid, has a body calming effect. Sometimes taking a little bit in the day, 200-300 milligrams, but taking much more in the evening, say 500 to 800 milligrams, even 1,000 at bedtime. Often what happens is you'll sleep very well, sleep very relaxed, get up, and have an easy bowel movement. So remember, magnesium can help and resolve things like constipation, sleep disturbance, insomnia, anxiety, palpitations, muscle fatigue, muscle cramping, muscle soreness. So always consider magnesium in your therapy, and looking at, from a whole wellness picture. Remember, here at Longevity Health Institute, my practitioners and me, we look at you in very detailed analysis. None better. We look at you from head to toe, from a cardiovascular, metabolic, chemistry, hormonally, and we look at you very personalized and put the whole picture together, okay? But consider your magnesium, consider your red blood cell and your micronutrient magnesium levels. Get yourself some good magnesium, and you'll feel a lot better and have a better quality of life and function. Amazing how good you can do with good sleep and good bowel function. So anyway, I hope this finds you well. Hope it's entertaining and educational. This is Dr. Lewerenz at Longevity Health Institute. Be well.